Welcome, 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 my Be Health Empowered family, to another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. Of course, please call me Dr. Mel. We are so delighted that you are joining us here this week because we're doing what we do every week here on Excuse Me, Doctor, which is to bring you the health information that you need to make wise and informed decisions for yourself, for your family, and even for your community. So if you're joining us for the first time and you're on Facebook, please go ahead and hit that like button. And if you're on YouTube with us, please go ahead and hit that red subscribe button. We really appreciate you for it. Now, those of you who are already in my Be Health Empowered family know that I don't roll without my co-hosts. So I got to bring them into the studio, and that would be Mr. Wayne Bruce and Miss Lila Mays. How are y'all doing?
Great. How are you, Dr. Mel?
Dr.
Doing
Mel,
good,
what's going
doing
on?
good.
What it do?
Hey, you know, it's February, it's some everything month. Black History Month, Heart Health Month.
It's some of everything.
Red shoe bottom month. I don't know. It's a lot going on.
That's funny, Dr. Mel. That is hilarious.
So we're just happy to be here for it. That's all.
Hey, I'm excited. I'm excited because today we got something special for the people. We got a very special guest.
Yes.
And I'm always excited when I can match hats with Lila first. We called each other and said wear the gray hat today. Then we
I didn't get the memo. The blue-gray hat.
The blue-gray hat. That's what we did.
Yeah, both of y'all looking very snazzy. And the maroon top.
I have to tease before the guest gets, so I have to tease these things.
Right.
I'm excited because I'm always excited when I get to save money, right? And get out of debt. Because I want us out of debt. I want all our people, all of us in the United States out of debt.
Right.
So what are we talking about today? Debt.
Well, we're talking about medical debt specifically. Yeah, and you know, a few years ago, I heard one of my favorite artists. His name is Vinx. He talked about a brain cancer diagnosis that he had just survived, and he talked about the fact that if he had not moved to France, where they have universal health care, he'd probably be dead because there was no way that he would have been able to afford all the medical care that was needed to take care of the brain cancer that he was diagnosed with. So, you know, he got out in front of it, but not all of us could just up and move to France, right?
Right.
So.
Right. It's a thing. I mean, and I feel like certainly Wayne and I, Wayne is a creative himself, we are attached to a lot of musicians and creatives, but even people who aren't creatives, who aren't like self-employed, you know, there are people who go through transitions where they lose their coverage and they have to go on Cobra and they can't afford Cobra, right?
Yeah.
And so there are these lapses in medical coverage where people can't pay for healthcare. So it's a very sensitive topic to me.
Right. We actually just heard, you know, Medicaid, when the public health emergency over COVID ended, a lot of people, their eligibility for Medicaid got reviewed and they got, quote unquote, kicked off of Medicaid. And so they are sort of out there, you know, trying to figure out, what do I do next? You know? So yeah, you're right. It is a very present issue for a lot of people.
Yeah.
So and so today, though, we got some solutions. We have an expert who's going to be bringing us the word on how to avoid medical debt, and if you're in it, what to do. So
basically,
it's going to be
how to crush medical debt, right?
Right. Which is the title of her book. So
I'm up on it.
Yeah, absolutely. Absolutely. So, but first, before we get to crushing medical debt and putting an end to medical debt, let us go to what's hot this week in health.
Yeah.
Right. The weekly recap.
The weekly. Do I need background music for this now?
We had it, didn't we, at one point?
No, we had that for the debunk, not for the recap.
Right. You got to work on that.
I'm going to have to do recap music. Here we go.
But anywho,
kick it off.
So first one, CDC is dropping the 5-day COVID isolation. I mean, so there's no longer a need. What does this mean? This is crazy.
Yeah, well, it's something they're considering. It's still being debated, but this kind of discussion makes people believe even more that COVID is no longer here, right? But we're still, since the beginning of the year, we've had 20,000 hospitalizations due to COVID. Every week, anywhere from 100 to 300 people are still dying of COVID. And there's a risk of long COVID. It's estimated somewhere between 10 and 25% of people who get COVID will go on to have these lingering symptoms beyond a month on out that can range from mental health issues to diabetes to high blood pressure, you name it. So it's definitely still there.
Yeah, that's wild. Yeah.
So the CDC is basically saying that, look, a lot of people have protection because they've had COVID or they've gotten vaccinated. The death rate has gone way down from the last Omicron surge. They're trying to bring it in line with their guidance on the flu and RSV. So they're proposing that if you test positive, you no longer have to routinely stay at home or miss work or miss school for those 5 days, that you should use symptoms as your guidance. So if you've gone 24 hours without having fever, but have, without using medicine like Tylenol or Motrin to bring it down, and your symptoms are mild and improving, then you should be able to go out.
That's crazy talk. I'm sorry. I know this is we go down a rabbit hole here, and we're going to try not to, but that seems a little scary because I know people who don't think they have fevers and have fevers, right? We all know the people who tough it through, right? And and because of them, they're going to expose people to this virus. And we have someone in the chat right now, Pam Chapman says she still has a cough and it won't go away. So the chances of getting long COVID for other people who are not trying to tough it through increase.
Right. Well, that is true. And a lot of people don't even realize they have COVID now. I can't tell you how many people I've talked to who say, oh, well, no, I don't have COVID. It's just a sore throat, or I don't have COVID. It's just sinus, right? But those are the symptoms. Now that we've been vaccinated and had 1 or 2 bouts of COVID, we're going to have milder symptoms. So you should still test. You should still mask. Especially if your symptoms are mild and you're going to be around people who are vulnerable, and you still need to again test to know if you need Paxlovid if you're one of the people who have underlying health conditions. And I still say get your booster at least once yearly. Talk to your doctor if you're in a high risk group, and potentially need to get a booster twice a year. But it's still here. We still have to protect each other.
We have to, because there's too many jokers out here walking around symptomatic and refuse to test. So listen to Dr. MEL and test and mask for these jokers.
On the joker side. So look, I'm wearing red. I'm wearing red because February is a lover's month, but it's also heart health month, right?
Yes, it is. Right.
And what do we have for the BHE fam to keep our heart healthy, right? What do we have?
Yeah, well, that first thing is, why should I get a little nutty, right?
Yeah. This isn't a mental health story, right?
Why should the rest of us get nutty?
We don't want anybody to get the wrong idea about getting nutty. This ain't about mental health. So tell them, Dr. MEL, why should we get a little nutty?
This is about the power of a handful of nuts and seeds in our diets.
Okay.
So nuts are nutritious food. It's nuts that we're talking about: almonds, walnuts, pecans, I'm from the South. I say pecans. So nuts are nutritional powerhouses. They're great sources of protein. Just a handful has about the same amount of protein as an egg. They also have fiber. They also have heart healthy fats in them that help to, decrease your risk of heart disease and stroke. We're talking in the range of like decreasing by 20% just by having nuts and seeds in your diet every day.
Wow.
Yes, there's a concern that they have calories. About a handful has about 170 calories. So just, don't go overboard on it.
Don't do 10 handfuls.
Right. So I don't know. What are some of the ways you guys get nuts in your diet?
Oh, that's a good question.
My wife buys a lot of nuts for me. And so I get nuts. Generally she buys them for herself, but I go in and steal those nuts because they almonds and I like almonds. And
Okay.
does almond milk count? Like that doesn't count,
Yeah.
right?
No,
Almond milk
counts. It's made from almonds.
Every morning I have almond milk in my coffee.
Okay, that's one way to do it. What about you, Lai?
I'm not a big nut eater, but I do occasionally add nuts to oatmeal.
Okay. All right. We got to get you in there.
I'm glad we don't have to say pause on that. You know what I'm saying? Wrong show.
I occasionally add almonds to oatmeal.
Well, keep in mind you can get it from nut butters, putting it on your bread, your apples, your carrots, your bananas. You can put flax seeds because remember seeds count too. So flax seeds, sunflower seeds. You can put them in your smoothies. You can make green beans with pine nuts or almonds. So you just got to get creative, mix it up a little bit.
Pine nuts. Okay. Hey, for one Thanksgiving, I don't remember this. My wife had me running around looking for pine nuts in about 12 stores.
Your wife is very wise. She probably knew, it was important to get those nuts in there.
I'm just
saying. I like pine nuts.
Just saying, they're not sold everywhere.
So that's getting a little nutty. What else do we have?
Look, what else? My best friend, he's gone. He's on another plane now, but he was one of my best friends. His name was Jeff. And Jeff was a Tai Chi master. And he used to always do Tai Chi in the park. And we lived in, in predominantly African-American neighborhood. It was not a high-end neighborhood. So people used to stop and wonder what he was doing. But he was a Tai Chi fighter, but he's also later in his life he used Tai Chi to really control his blood pressure and different things.
Well, he was a pioneer then.
Yeah, he was.
Because that's exactly what this is about. Uncontrolled high blood pressure is a leading risk for heart disease, and about 1 in 4 people who have high blood pressure don't have it under control. So you really need multiple ways to control your blood pressure: sleep, exercise, lowering your sugar and your salt intake, getting more fruits and veggies, staying active. But this is where the Tai Chi comes in. Tai Chi by itself can help lower blood pressure more effectively than aerobic exercise.
Wow.
Think walking, think jogging, that kind of stuff. And so you know what Tai Chi is, right?
Explain to him. Go ahead. I know, but
I
want you to explain to him. Explain to him, Dr. Mel.
You may have seen people doing it in the park, just like you mentioned that Jeff did, but it's slow, rhythmic hand movements that actually affect a section of our nervous system called the parasympathetic nervous system, which is the opposite of our fight or flight response, which is what raises our blood pressure. So it relaxes everything, including blood pressure. So multiple studies show that if you consistently practice Tai Chi, it can be really an important tool in your toolkit to keep your blood pressure down.
Wow. Cool. And there we go.
Yeah.
So keep your blood pressure
down. We're ready. Yeah. So now we're ready for our next segment. What y'all think?
And we're going to switch.
Love that. I love that. So this week, it's a little weather in Los Angeles. We don't know what to do with that. So we had to take it into someone's house. And we asked them to share with us joy spark. And, meaning what brings them joy. So let's roll that clip one. Hi there, I'm Lila from Excuse Me Doctors, What Y'all Think? And this week we're going to be talking about joy. I believe that joy can help contribute to better heart health. Do you believe that? I do. Okay, so can you tell me a couple of joy sparks for yourself?
Sure. One is cooking. I love to cook. I'm very passionate about it. And I love preparing meals for those I love and seeing their joy in eating the meal. Okay. Second is travel. And oh gosh, anywhere that I'm outside the house for a couple of days to a week or two brings me freedom, and freedom is joy. And so just to be with someone I love outside the city limits is my peace and my joy. Thank you.
That is excellent. I love that. And again, it's Heart Health Month. And that's just right on time because, joy helps to, again, relax our parasympathetic nervous system, take away that fight or flight response, and it is essential for heart health. So thank you, Lila. And I hope everybody is putting their joy sparks in the
what
chat.
Sparks joy? Put it in the chat. Put it in the chat.
I have to say, one of my joy sparks is adult coloring books. That's one of my joy sparks.
Ooh. Okay.
Adult coloring books.
Not like adult like that. Like,
Pause.
This is a PG show.
This is pause.
This is a PG show, and I meant that very PG.
I know what you meant. Other people find paint by numbers is similar to that, but it's in a coloring book. Yeah.
Adult.
Well, mine is words with friends.
Yes.
Yeah.
What words spark your joy?
Out. And of course, music. Music is my joy spark.
Yeah, music is my joy spark. I mean, all types of music. It doesn't have to be one type of music. Just all types.
Yeah.
Right. All right. Well, thank you all. Remember, put your joy sparks in the chat, and we're going to see Lila and Wayne in a little bit because now we are about to talk about putting an end to medical debt. Lost homes, retirement accounts emptied, struggling to feed and clothe your family. Medical debt is to blame, and it touches more than 100 million people in the United States. People from all walks of life, corners of the country, are living with healthcare debt while at the same time trying to manage their chronic health conditions or if they're recovering from an accident. So we're going to understand what's causing this and what you can do to not be affected or go under due to medical debt. Our excellent guest tonight. I'm so excited to introduce her, Dr. Virgie Bright Ellington. She's an internal medicine physician, former health insurance executive, medical billing expert, and principal of Crush Medical Debt. She's the author of What Your Doctor Wants You to Know to Crush Medical Debt, and she hosts a podcast every week, Crush Medical Debt, Medical Bills Uncovered. So I am welcoming her to Excuse Me Doctor. So happy. We used to work together back in the day, so I'm really excited to see her again. Hi, Dr. Bright Ellington.
Dr. Mel, it is so awesome to see you and connect with you again and see that bright, beautiful smile. It's been a while, so I'm so happy.
Well, thank you. Well, we're going to get into it because I know people have a ton of questions. So let's just start at the top. What are the causes of people going into medical debt in the United States? And I qualify the United States because, as I mentioned in the beginning, a lot of other industrialized countries have universal health care. So we're kind of unique sitting out here.
You got it. You hit it right on the head. The United States, medical debt is a uniquely American problem. So like you said, other developed countries don't have this issue. They have some form of healthcare, at least 2 tiers of healthcare. If they're a wealthier developed country, they have universal healthcare and they have the option of private healthcare, just like In the States, we have private, public education and that kind of thing. So you hit it right on the head. It's a uniquely American problem. Medical debt doesn't exist in other industrialized countries.
So, given that that's the case, we do have these safety net systems in the United States. We have Medicare for seniors and those who are disabled, and we have Medicaid for low income individuals. Why is it that taking you?
You know what, the audio dropped a little bit, Dr. Mel. You said your question was again?
I said, so we have Medicaid, we have private insurance, and we have Medicare for seniors and those who are disabled. So why aren't these systems taking care of these issues?
Yes. So this is the thing. Medicaid is health care for folks in these states. It's state health care, and they have each state has different cutoffs for income that qualifies. And in many states, you have to really, really have like minimal income, and they don't like scale you in. If you're $1 above, then you're completely cut off. So you mentioned earlier at the top of the show that with the dropping of the COVID emergency, where during the COVID emergency, they expanded Medicare. So people who are above what used to be the cutoff can actually get covered by Medicaid. And now they're rolling that back. So the question is, you have all these people who are now without health care, back to the way it was. And in many states, like, unfortunately, there's like 10 states, unfortunately, mostly in the South, that never participated in Medicaid expansion, meaning they refused to take the federal money to help folks that made a little bit more than the old cutoff. All right. So what do? All of these folks that don't qualify for Medicaid anymore, or now that need it all of a sudden don't qualify. So what do? So there's a final safety net that many people don't know about, and that's what's called federally qualified health centers, FQHCs. And that encompasses two things. What people think of as in more urban settings as community health centers, but what's really important is in rural health center, or rural areas, or rural health clinics, or rural health centers. So if you go on, and I'll send this, and we can post this in the show notes. If you go on, and you can go on the government site that has the locators for FQHCs, you can actually go in and find the one that's near you. And why this is important is because they will take all comers. Doesn't matter if you have insurance or not. And what they do is they take your income on a sliding scale basis. So if you have no income, well, then you can still show up. And what's nice about it is they cover primary care, they cover mental health services and dental services. So it's a big deal. If you can't qualify for Medicaid, if you can't qualify for subsidies for the federal exchange or Obamacare or ACA, it's also known as, then that's a great option. Now, there are some people who can't afford, let's say, they make too much money for Medicaid, they make too much money for subsidies, and they still can't quite afford traditional health coverage. What to do? If you have a little bit more resources.
But before we get to that, I want to just jump into, you mentioned Obamacare in the marketplace. Can you talk about that? Because a lot of people don't understand the reason why the Affordable Care Act created marketplaces. Who are they for?
So originally the point of the Affordable Care Act was to make healthcare accessible to everyone. And so before the Affordable Care Act, there were pre-existing conditions that insurance companies were able to say, well, no, you have a pre-existing condition, so you don't have access to healthcare discounts, basically. So health insurance doesn't guarantee that you don't have any. It doesn't guarantee financial protection. It just says that you have access to discounted health care. So before the ACA, the Affordable Care Act, was put into place, the thing was that many folks could not get any kind of health insurance coverage. they were just stuck. So no matter how, it was really, really exorbitant if they had pre-existing conditions, if they could find any insurance company that would take them. So that's why it was put into place. So when it was put into place, the thing was, the insurance companies had to say, okay, we have to take all comers. They were informed that this is the way it's going to be. You guys are going to take all comers. And this is actually why health debt or medical debt, healthcare debt, overwhelming bills from healthcare and medical care has really astronomically increased, because most insurance companies are run by publicly traded companies, which means that they're going to make their money somehow, because year after year after year, they have to make a profit for their shareholders or stockholders. So if they can't protect their money by making sure they keep out the expensive people, the people with pre-existing conditions, what they did was, Dr. Mel, was institute co-insurance. And what co-insurance is, the insurance company says, okay, if you have an issue and we agree to cover it, and that's an if, because there's a lot of things they won't cover. If we agree to cover it, if you have, you're going to have co-insurance. So it ranges from 10% co-insurance all the way up to 40%. So 90% is the health insurance company will say, okay, we'll pay that, but you're on the hook for 10%. And then the 60-40 is 60% will cover, and you're on the hook for 40%. That's a big number.
So you're paying your deductible, right? You're paying your deductible, your premium, and you're paying that co-insurance. So, but the Affordable Care Act, but the Affordable Care Act, one of the things that it did, right, in addition to opening it up to make sure that insurance companies would take all comers, is their subsidies, which you mentioned before, so that people can potentially, if they make too much to qualify for Medicaid, but not enough to buy insurance outright, they can get subsidies on some of the marketplaces. Correct?
Yeah, that's the idea. And it does help. It helped, but it didn't cover everybody. There's still a huge gap, Dr. Mel. So there's still an issue. And so because of this co-insurance thing that the insurance companies did after the ACA to try to make sure they get a little bit of their money, that's contributed to the big exponential increase in medical debt in the United States.
So are there any groups that are disproportionately affected by medical debt?
Always, those of us, in this country that have had limited access to healthcare and limited access to resources by design, right? By the system of things, by the federal government. Those of us of African descent in this country, we're always going to be at risk more than the majority, essentially, population in this country. So those of us who have been blocked from resources in this country historically, those of us of African descent, Native American descent, we're going to be at higher risk and significantly higher risk of being crushed by overwhelming medical bills and becoming crushed by overwhelming medical debt.
Right. Now, before we get to the solutions, which I know you have several, I want to explore just some of the consequences of getting into medical debt. Why do you not want to get into medical debt? So, for example, if you're being treated and you can't pay your bills, can you be turned down for further treatment?
If it's an emergency, you can never be turned down for treatment. Just if you have a huge bill with a hospital that has an emergency room, you've been there several times. If it's an emergency, they can't turn you away. However, anything other than an emergency, urgent care or outpatient care, anything that's not emergency, you can be turned away from further care.
What about, does it show up on your credit? Can you be sued or arrested for again, getting into medical debt?
Yeah. Fortunately, the United States has banned debtor's prison for about 200 years. That's a savior. But Not really. You know, you still get your life destroyed by medical bills. So what happens is if you can't afford your medical bills, many things happen. You decide, okay, well, you know what? I know I have this health problem, this chronic condition, and I'm going to save some money. So I'm going to, instead of taking my medicine, like the doc said, every day, I'm going to take it every other day, that kind of thing. Or, you know what, I'm just going to just get my routine follow-up health care. Or, you know what, I know I'm having this pain again, I'm just going to just tough it out. And what that does is there's actually data that shows that it shortens your life. There's increased morbidity and mortality, which means death, when you have medical debt. And there's a lot of data that shows that, unfortunately. The other thing is, there are many states that will still let hospitals and medical facilities come after you in court to garnish your wages and put liens on your home. And again, this is unfortunately more in the southern states where they've refused to expand Medicaid. So people are really put in a tough position. They're at higher risk of having medical debt. There are some states that said, you know what, like Colorado and New York State said, you know what, we're not going to allow this. You cannot have any medical debt, any bills from medical facilities or medical providers go to a state or go to court where it can be a lien, end up with a lien on your home, garnishing your wages, and now it cannot be referred to the 3 credit reporting agencies, so it doesn't hit your FICO score, which is what many debt collectors would use to try to force you to pay up, to intimidate folks to paying.
Yeah, that's good to know. So I know you have another number of solutions. So the first thing I want to talk about is getting insurance or some sort of coverage. So there are lots of people who are self-employed. We talked about them, earlier. There are a lot of people who are unemployed, who've lost their jobs. They're going without health insurance. What would you advise them to do?
I tell people, please, don't go bareback. I call it. Please don't. So I say this to not just folks who have fallen off of Medicare, that got kicked off of Medicare, Medicaid. Medicaid is, again, state insurance. Medicare is insurance for folks that are over the age of 65 or younger who have chronic medical conditions. Anyway, we were talking about Medicaid, which is state insurance for folks that have income below a certain level. So if you don't make that and you still don't qualify for a subsidy that you can afford for the ACA, or it's called Obamacare, like we talked about earlier, then you have 2 options I recommend. And we talked about this earlier, the FQHC. Look to see if there's an FQHC near you. Or if you have a little bit more resources.
Community health center.
That's the community health centers and the rural health centers, just call them across both urban areas and suburban and rural areas, just community health centers through the FQHC umbrella. But also, if you have a little bit more resources, look into what's called direct primary care practices, or DPC. And what you do is you pay, it's basically a membership. You pay, like, on average, I would say it's about $100 per person in your family. And that gives you access per month. So it's like a membership. And you have access to often telehealth, but usually in-person services, usually a combo of both. So that's a big, huge thing. So my point is, FQHC, or direct primary care, DPC, for your primary care. Make sure that you don't skip your primary care, your preventive care. Make sure that's taken care of. And then, Dr. Mel, step 2, this is the important point. Do not risk your financial future. Have some kind of risk management with insurance. So what do we do? So do something that's affordable, because even with the ACA subsidies, it's still out of reach for so many people. Do something so you're protected from catastrophe. So what I call catastrophic health insurance, many people refer to it as supplemental insurance. These are insurances that are accidental insurance, critical illness insurance, and hospitalization or hospitalization insurance. And what you do is, if you say that, look, I have a history of this in my family, I'm concerned about this, you apply to get for it can be less than $100 a month, depending on what it is. And it can go all the way up to $300 or $400 a month, depending on what the issue is and what you're concerned about. If the insurance company that does the underwriting says, okay, yes, we will issue you a policy, that's what you want to do. Purchase a critical illness, accidental or hospitalization policy to protect you from catastrophe. And what that does, Dr. MEL, is give you a flat payment that covers anything you want to spend. So it not just covers medical bills, but when we get sick or injured, we miss out on work. So bills, other bills pile up. It helps to, like transportation issues, it helps us a flat fee, or I should say flat payment that covers things in case of, God forbid, a medical or accident or injury catastrophe.
Right. And so many things come up, like you said, that if you've never gone through it, you don't even know what to anticipate. So that's really important. Now, I know that's great advice for whether you're, essentially healthy or whether you have underlying health conditions. I would also ask, when a medical bill comes to your door, right? You've been hospitalized or you've had maybe several doctor visits. What percentage of medical bills have mistakes on them?
Most of them. If you've been living in the United States long enough, you had to interact with the U.S. healthcare system, you've been taken. You've overpaid. 8 to 9 out of every 10 bills have mistakes. And if you can probably guess, they're not going to be in our favor, right? They're not going to be in the favor of the patient, the consumer. So that's why you have to understand the rules of the game. I say this a lot. How does it go? I never hate a hustler, right? Don't hate the player, hate the game. Well, you got to learn the rules of the game because you are being played. You are in it, whether you want to admit it or understand it or not.
So what are the 3 steps you should take if you get a large medical bill? And I know these are on your website. So definitely let us know.
It's a big thing. You want to know how the game is played. And I call it just basic medical financial literacy. And the American healthcare system, and I don't want to sound like, conspiratorial. I don't want to sound like it's a conspiracy, but it is the system and you got to understand how it works. So because of the way the system works, you got to understand that because 80 to 90% of all bills have mistakes. You got to figure out how to find out, okay, am I being overcharged? Because 8 to 9 times out of 10 you are. These mistakes are not going to be in your favor. They're going to be in the favor of the provider or the insurance company if you have insurance. So number 1, step 1 of the only right way to pay a medical bill so you don't get overcharged, you don't overpay and go into debt, is to make sure you get a real bill. 8 to 9 times out of 10, the first bill you get is not, or even sometimes the second or third bill is not a real bill. What's a real bill? A real bill has what's called CPT codes. And what CPT codes are, Dr. MEL, are to medical services what barcodes are to products in a retail store. So every thing you can think of, every service you can think of, medical service, you can think of getting in the United States has a unique CPT code. Every test, procedure, operation, emergency room visit, outpatient doctor visit, they each have a unique CPT code. So you're going to call back when you get, I laugh. I say this all the time. I laugh so I don't cry because it's just outrageous. But 8 to 9 times out of 10, when you get this document, I call it a statement in the mail. I don't call it a bill. It does not have CPT written on it. And if it does not have CPT written on it or CPT/HCPCS HCPCS on it, then you're going to call back. There's always, I call it the wishing number, and usually in the upper right-hand corner underneath, they have like, hey, questions, call our billing department. Yeah, I call that the wishing number in the upper right-hand corner because they're wishing and hoping and praying that you'll fall for it. You think it's a real bill and you'll try to pay it. So anyway, under that number, you're going to call, under that wishing number, you're going to call the phone number underneath and say, hey, yeah, this is not a real bill. I need something with, quote, CPT codes, unquote. And that's the really important first step. And you're going to get pushback, frankly, at that step. Some will say, well, we don't have that here. But by federal law, they'll say, a lot of times this cracks me up, Dr. Mel. They'll say, oh, maybe you can get that in the records department. No. Anyway.
No, it's from the billing department. So you push and you push and you push, and then you get that CPT bill. What do you do with it?
And by the way, when they do push back, you want to say, hey, by federal law, by HIPAA law, people think HIPAA is a privacy law. It's actually saying you have rights to anything to do with your healthcare, even finances, your right to have. So once you get that, step 2, you're going to Google or now do Gemini or ChatGPT. You do an AI search of the CPT codes. And what you're doing is you're checking to make sure the description of the CPT code, you're going to say CPT 99213. And that's a form of outpatient visit. You're going to make sure, number 1, the description sounds like services you had, to make sure you're not getting upcharged or okay, I had a arm fracture in the emergency room. They just put a sling on it and had me follow up with my doc closer, an orthopedic closer to my home. But they sent me a bill for a humeral fracture intervention. Well, that's a bit more expensive than just a sling. So just make sure you're not getting upcharged, that kind of thing. It sounds like services that you had. And most importantly, Dr. Mel, this is the key. While you're there, you're Googling or in Gemini or ChatGPT, you're going to look to see what Medicare pays for that CPT code, because Medicare is the absolute lowest price that you can get for any provider will accept for medical services in the United States.
And that's Medicare. Just want everybody to be clear, Medicare.
Medicare. And people think, well, their eyes will glaze over when I tell them this, Dr. Mel. They're like, well, I'm not old. That's for old people. Medicare is for old people. And I was like, well, okay. And it's for people that have chronic conditions who are younger. But this is the thing. This is the price that is the lowest, most fair retail price that providers accept. And just because you don't have Medicare insurance doesn't mean that you don't have the right to be able to automatically negotiate that and say, hey, I'm not willing to pay more just because I don't, why would I pay more? So that's the big.
A lot of people don't realize that insurance companies have a negotiated rate. And so what you get charged if you don't have insurance is way more than that. And so using that Medicare as the reference point is exactly what it's all about. Yeah.
I call that, you hit it right on the head, Dr. Mel. I call that the MRSP, the manufacturer retail sticker price. That is the provider, is what the provider, the hospital, that's that first number. It's a fantasy number. They just make it up. And it's 10 times, it sounds crazy, but sometimes it's 10 times more than what Medicare will pay for that service. So it's not a real number. So that's a huge important step to get those numbers, total up, and take it to step 3. Say, for example, we're going to use a hypothetical example. Let's say that you had to have emergency hernia surgery, and that first bill they sent you, that fake bill, that wishing number was $10,000. And then what you're going to do is, after you've done the first 2 steps, you're going to be like, oh my gosh, Medicare pays a total of $3,000 for this service. So you're going to call back step 3, and you're going to say, that number, that billing office number or patient accounts number under that wishing fantasy number, you're going to call that back in step 3 and say, hey, that bill you sent me for $10,000. Yeah, in my case, I am willing to and able to pay $3,000 in our hypothetical example. Who can I speak with? Who can help me make a payment plan? And I tell people, it doesn't matter how long it takes you to pay this off. 60 months, 5 years, it does not matter. Make sure it's in your budget, because if you have a bad month, and they're going to give you pushback, that's their job. The folks in the front lines answering those phones, you're going to say, well, let's say in our hypothetical example, Dr. Mel, that's $3,000 we came up with doing the 3 steps of the only right way to pay a medical bill. And we're like, you know what? Emergencies never happen at a good time. I can only can't get blood from a stone, right? I can only squeeze out maybe $50 extra out of my budget to pay on this. The person is going to give you pushback and say, wow, you know what? Even if we do accept that $3,000, it's going to take us forever to get our money. Yeah. And the thing is, why they're going to accept that, stick your gun, stand your ground, because you are being proactive. They don't have to chase you, where they may not get any money at all, except, pennies on a dollar.
They'd rather get something rather than nothing. And just you're engaging and offering to pay something is something they'll do. Hey, I can't believe it's actually time to bring Wayne and Lila back in with the audience questions, because we didn't get through everything, but I'm sure that people have some questions in the chat. So let's bring them in and see what we have.
Live, what you got?
What's it looking like?
Dr. Bright Ellington, there were so many acronyms. I was trying to write my notes and keep up with what was happening in the chat. But one of the questions I have from the West Coast is, you spoke about direct primary care. I can't think of everything that was there, but is companies like tech-enabled companies like Forward, are those the kinds of companies that are direct primary care companies that we can sign up for online?
So I haven't heard of that one. I've heard of Mira Health.
Maybe it's West. Maybe it's West Coast.
That one, I'm not saying that it's not a DPC. It's not a direct primary care practice. I'm just not familiar with that one. What you can do is also, I can put this in the show notes online, look up the locations of DPC practices or direct primary care practices. So that's one thing. Also, even though it's not technically a direct primary care practice that is run this way, is Mira Health, MRA Health.
One Medical is also another one that's pretty popular as well.
We'll drop those in the chat. One Medical, and then what was the Mira again?
Mira is like Mira look in Espanol and Spanish, MIRA. Yep. I want to say, Dr. Mel, I don't believe that One Medical is not considered a DPC, and that's because they will bill your insurance. If you have insurance, there is a fee. So the differences between direct primary care practices or DPC practices and like One Medical or concierge practices is that flat membership fee you pay every month per member is it.
Okay.
Got it. Thanks.
All the difference.
Thanks for clarifying that.
Just like all the rest of them, they're not at all a DPC.
Okay.
Right.
Okay.
I think Forward is. Wayne, you have any questions on YouTube?
Yeah, I have a question. A question comes from, I can't pronounce it. David. Let's just say David. And he asked, what about affording prescription drugs? Are there any resources for your medications that you can,
great question,
so you can
David.
afford them?
That's an awesome question, David. So there's a couple of things. I always say, try to look up the medication. If it's a medication that is covered by what's called the free prescription discount card programs, you see commercials for them, like GoodRx, Single Care. In my experience, I have to say Single Care, most often more than any of them, even though some have more advertisements and is more familiar to folks because of the advertisements. I think Single Care actually more often has the cheapest prices, even if you even compared to insurance and your copay. If you go to the pharmacy, just say, hey, can you run them through the discount cards or show them, you'll print out Single Care or whatever. Just they all have different ones. So that's the first thing. But if it's something that is not covered, let's say still with the free prescription discount card programs, it's still kind of exorbitant. Talk to your doc about if you can get samples, and while you're waiting, getting the samples, apply for many of the pharmaceutical companies have like financial assistance where they actually will cover the really expensive medications for you. So, but that's a long process. You have to apply and get your doc support with that. And in the meantime, ask your doc for samples.
So samples directly from the doctor's office, not having to go to a pharmacy. Okay.
From the doctor's office.
Wow.
That's for the expensive drugs, or even sometimes not expensive drugs. Doctors have samples on hand to kind of tie you over.
Okay.
Okay.
I'm sorry. I'm writing notes for.
Okay, I got another question. and it's probably a question that everybody is asking. How can we become? What are the steps to become more medically financially literate? Should it be taught in like schools? Because this kind of stuff we don't get a lot.
Yeah, nobody gets it unless they get it from Dr. Bright Ellington.
You know what? So whoever asked that question, you're just, a man or woman after my own heart. So this is a thing. So folks in the United States are realizing, yeah, we're not taught any of this in school. And so right now, 14 out of the 50 states require basic personal financial literacy taught in high schools. And so we're talking about including basic medical financial literacy included in these personal financial literacy high school courses and required programs, essentially. So it's not, we're just getting started. Yeah, we got to get the message out there. Within the United States, unfortunately, without medical financial literacy, you don't have financial stability. It's real.
Right. So Wayne has been popping your book up. Can you let the people know where they can find your book?
Any place where you like to buy your books. So some people don't want to use a certain very popular online resource. You can go online at Barnes and Noble's, or you can go into Barnes and Noble's actual store and they will ship it to their store free and just go back and pick it up. Or they actually have online independent retailers. So any place where you like to find your books and buy your books, we're there.
Thank you.
And while you're at it, can you also tell what kind of resources you have on your website?
Oh gosh, thank you for bringing that up, Dr. Mel. So what I really try to do is to make sure all this information is available for free. If you don't want to buy the book, you don't have to. I try to have this information for free on the podcast every week on the Voice America Health and Wellness Network and the also the Empowerment Network. We're on with Voice America, the voiceamerica.com internet radio, but also on the site, I have all of the resources that I refer to, like the single care free prescription discount card. You can download it from there. The 3 steps, I have a cheat sheet for you there. You can just download that of the 3 steps of the only right way to pay a medical bill and not get taken advantage of. So I also have lots of other resources that for free coverage and information to get free coverage of your care.
Fantastic.
Great. Do we have time for one more question?
Yeah, we do.
I have one.
Go ahead.
Yeah. So, do hospitals ever give you a break if you can't pay?
Excellent question.
Or
so you know what? I was trying to be a good girl and not just go on and on and on and talk about all the resources that we all have rights to. But that's where I was going with it. Also on the website, I also have a link to an organization called $4.org. And what they do is, and you can do this yourself, but they've kind of gotten it down to an art. In the United States, 65% of hospitals and medical centers are nonprofit. And what that means is that by law, they have to, in exchange for not paying a dime on the millions and millions of dollars of revenue they get, they don't pay a dime of taxes in exchange for providing coverage or care, sliding scale income based, basically discounts for care in the communities in which they operate. So by law, they have to have applications for, you can call it whatever you want, financial aid, financial assistance, charity care. What it is doesn't matter how high your income is, apply. They have to give you the application and apply. And sometimes, you think that, oh my gosh, well, my income is so high, there's no way I'm going to afford it. You know what? Qualify rather. The thing is, your medical bill, your hospital bill at a nonprofit facility may be so high in proportion to your income that you qualify. And in New York State, I had a client who was able to have a $10,000 bill completely wiped out. And I think her gross salary, annual salary is something like $125K a year. So always apply. Yes. That was a long answer to your question, Dr. Mel. Yes. You have discounts. please always apply. If you have a big bill that's from a hospital, apply. Last thing, you would think that the for-profit facilities in Texas and in Florida, most of the hospitals are actually for-profit. You'd be surprised. Sometimes the for-profit facilities, they have discount programs and financial aid applications that are more generous than many nonprofit facilities. So always call and ask before you pay that bill. Right. Even if it's a bill with CPT codes, please always, if it's a hospital bill, apply for their financial aid.
Yeah. Wow. And I think there are organizations too that have counselors or agencies that actually will help you, like patientadvocate.org. Yes. That can also help you too to fight those bills. Yeah.
You know, Dr. Mel, you're going to make people think that I paid you to do all this, to say all this. But no, that's the last thing I do want to share. That's also on the site. The crushmedicaldebt.com site is a link to, under resources, to the Patient Advocate Foundation, which offers free help. If you're when we're sick and we go to the hospital because, or we have a lot of medical bills because we're sick or in pain or had to have, we're injured, we don't feel great. If you're getting crushed by bills, instead of you crushing the bills, reach out to the Patient Advocate Foundation, which helps you and advocates for you with all of this stuff for free. Please check it out. They're a great resource that folks don't know about.
I didn't pay you to say any of it, but we are kindred spirits. We want people to have this information. We want them to be empowered when it comes to their health. So thank you. You've just been a wealth of information, Dr. Bright Ellington. Thanks so much for being on. And of course, my co-host, couldn't do it without you. Thank you for bringing all the wisdom from the streets and from the chats. Really appreciate you. Absolutely. And of course, Be Health Empowered family, thank you so much for joining. You have some great questions. And remember, until I see you again, be wise, be well, and be health empowered. Thank you so much for joining us.